Hi everyone, thank you for being here. I really appreciate it. The talk today is basically based around brain longevity and fall prevention. And the reason why we target that is because most individuals in here are probably worried about both of those things. However, even at 34 years old, I'm worried about it too. So the name of my clinic is the Brain Health Clinics. And I'll explain why a chiropractor would own something called the Brain Health Clinics next. But my name is Tyler Hurst. This young man down here is named Christian Holdridge. He's not here today. That is me up there, okay? So I am not the type, my brainiac, fresh out of school doctor here wrote this for us a year ago. I am a little more to the point and will probably talk more than I use this. But images are helpful and it'll keep me on pace so I don't go over. Classically, my staff knows that I'm going to be late today because I talk too much, especially when people like you are interested. The first thing about this lecture is I love this discipline. I love the brain so much I tattooed one on my arm. So I have 3 personal goals in life, all right? The first one is be the best husband that I can be. The second one is be the best father that I can be. And the third one is be the best doctor that I can be. I'm doing all right on the last one. You'll have to ask my family about the first 2. So I've been doing this for about 10 years. Every day of my life I talk to 20, 30 people about their brains and what we're supposed to do in terms of health. What's different about chiropractic neurology and why chiropractors are called functional neurologists, okay? So chiropractors nowadays, and I'm sure everyone in this room has heard about chiropractic, seen a chiropractor, heard a friend that went and it didn't work or it did. But chiropractors nowadays specialize. So when I went through school about a dozen years ago, there is a board called the International Academy of Chiropractic Neurology. And basically that's a board certification related to the treatment and diagnosis of neurological conditions. You have to obtain a doctorate degree before you get the 2-year postgraduate degree. So the joke that I always make is I read a couple of extra books and got 5 letters behind my name, all right? So it's a total of 7 letters now. But chiropractors nowadays specialize. There are many specialties in chiropractic, just like you guys would think in Western medicine or allopathic doctors. They specialize in the brain or the heart or the foot or whatever it may be. Chiropractors are doing the same thing. Now the difference between the states, and it's different in every state for chiropractors, we don't have prescription rights. They're fighting for them in several states because we know a lot about pharmacology and toxicology and things like that. The school that I went to and Dr. Holdridge went to, we were actually trained as primary care physicians first. And then we learned about how to manipulate the spine, learned about diagnosis of other things outside of spinal treatments. The joke I make there is I did prostate exams and drew blood and stuff like that long before I ever cracked anyone's back. And my wife's going to hate that that's on television that I said crack back. So yeah, chiropractors are kind of famous for spinal manipulation, working on the spine, and we do that in our office. So I adjust every patient for the most part in some way, shape, or form, but it is geared towards their brain, their neurology, okay? Every chiropractor that you've ever met or you see on the side of the road, they get about a year's worth of neuroscience. So they know a lot about the brain, whether they admit it however far out from school they are or whatever it may be. But every chiro gets a lot of neurology training. A lot more than most primary care physicians actually. So if you have a brain question, chiros can kind of answer it. But the functional neurology piece gets down into the weeds. Okay, so the introduction to functional neurology and its role in retirement health, I like that he used that. He's 27 years old, so he's using young man terms. I don't even know what retirement health would be. What year is retirement, Christian? Anyway, so functional neurology focuses on brain-based care to enhance balance, memory, movement, and especially important during retirement. Let's say after the 5th or 6th decade, right? That's true throughout though, okay? So when we look at understanding what functional neurology is, this one gets a little wordy, so I'll kind of jump around. This is what I like to say. medical neurology, and this is not a knock on them, this is their training and what they do as a profession, they're going to look at gross pathology, meaning you get referred to them by another doctor, they take a picture of your head, they take a picture of your low back, and they say, you have this problem, here's the treatment. Not to throw them under the bus, most of the time the treatment is, I'm going to cut it or I'm going to give it medicine, okay? And sometimes those work and sometimes those don't. Sometimes my stuff works and sometimes it doesn't. I'm not going to say that we're different there. Where functional neurology differs is we don't have those two options to cut you or give it medicine, right? So what we do is we get down into the weeds, and what I mean by that is we are looking at the functional aspects of your brain. So does your right eye and your left eye do the same thing? If I move them to the left, do they do the same thing? If I move them to the right, do they do the same thing? Now in medical neurology, if we're just using this ophthalmology principle, meaning what do your eyes do? In medical neurology, what they do is they go, can you see my finger? And they go so fast, you go, yeah, kinda. And as long as it's what they call conjugate, meaning they move rather together, you're good, okay? But for me, if everyone up here watches this cursor, or this laser rather, scroll across, sorry, I had coffee, a little shake. So if they watch that scroll across there, and your eyes go like this, well, that doesn't look functional. And then vice versa, if I go this way and they look like this, what we're trained to see is if I go this way, this would be to everyone's right in this room, right? If I go this way and it's smooth, my right frontal system's actually working pretty good. And my left cerebellum is actually working pretty good together with it. Meaning my eyes can hold that position and move in a smooth direction, or in a smooth pursuit. Okay? So we start by evaluating the little nuts and bolts of, ma'am, I like to always use the person in the front. What is your name, may I?
Carolyn.
Carolyn. So I'm going to say, Miss Carolyn, will you look at my note? That was actually my preschool teacher. It sounds weird to say Miss Carolyn, but that's fun. Miss Carolyn, would you look at my nose? And if one eye is looking directly at the center of my nose, but the other one's kind of floating, we're going to chase that, okay? And that's where we start the balance assessment. So clinical approach to leveraging brain plasticity, again, fancy words. Functional neurology utilizes brain plasticity to restore and optimize neurological functions. What does that mean? Therapies include cerebellar rehabilitation, proprioceptive training, eye tracking, and vestibular conditioning to improve balance and cognition. So if we take those sentences just a step further, and I'll apply this to Miss Carolyn. I'm not going to speak about her direct health, I don't know it, but I'm going to use her just as a general example. Where I would start with her, she's lovely, she's dressed great today, so her affect is awesome, right? Her brain works pretty good. She organized herself, she's doing okay. But if I sit her in front of me, the thing that I'm going to look at in terms of what therapy am I going to use on this lady to make her balance better or her cognition more smooth, what I would notice is, the first thing that I would notice is her head is slightly right of center, okay? And that, if we can all picture this, because some of us, if I look around the room, we're going both ways in either direction, all across the room, including my younger friends in the back, including myself. My kids got into a little argument before I left today, so maybe my pupils are a little off because I was a little zinged, right? So we're looking at those subtle little findings, meaning like if you go into the standard doctor, they're not going to talk about that head tilting because they don't necessarily, not that they don't care, they're not approaching it in the same capacity or for the same reasons. So when I look at that right head tilt, what does that mean in terms of her neurosystem and how gravity affects it? So today's talk is about cognition and balance, so I'm going to stick in that camp, but we can go all the way down in the weeds to how does it make your heart beat? How does it make your left foot hit the ground? How does it, so we can get deeper if we want to. We only have an hour, so I'm going to try to stay up here. But what we do is we will basically look at the patient goal. If I'm using Miss Carolyn as my example, and I'm seeing, and this is where I'm going to go, balance and dizziness issues, okay? If I'm seeing that rightward head tilt, that's one giveaway of what her balance system is saying. So an analogy that everyone in here can probably appreciate, or they've sensed before, which I hope is not true, but probably true. If we could all picture a level on top of a picture frame, all right? We were blessed with 9 of them on either side of our head. And so what that means is if my head is constantly tilted like this, the level that is in my right ear and the level that is in the back side of my left ear are off center, or they're like this, right? And so she spends, even in her, I will say in her sleeping hours, but let's say in her waking hours, the individual with this rightward head tilt, I'll leave Carolyn alone, she's been a great sport. The individual with this right head tilt, her center of gravity has moved from right here to right there. And so what that means throughout life, I'll use an easy example for us to understand. This would fit in my kitchen. The dishwasher's here and the sink is here. But if I'm leaning already a quarter of the way to the dishwasher and I go down and I grab a plate off the bottom shelf and I come back up to the sink. You felt that before? Yeah, of course. Yeah, we all have that. We all have, depending on what you're doing in your life. Like, you can do this when you're young too. But, so balance and dizziness starts with the upright evaluation. And then, so head tilt is the first thing to look at, right? The level in which it is positioned is different for everyone. And then you go, well, how did the level get that way? That's a great question. A lot of times in the young population out here, there is some type of toxicity that attacked your ear or had created a depreciation of the function of the ear. So if you look at the otolaryngology page, the archive of what causes your ears to go bad, it's called the list of ototoxicities. That thing's like 350 tabs long. Everything from Tylenol to high fructose corn syrup's on that list. So if you, let me play that out in years, right? If I take a certain over-the-counter every day for 40 years, it's going to start making that ear bad. So then that's why everyone in this group knows somebody where their ears ring all the time, or they have had a bout of vertigo. If I went across the board and went, hey, how many of you had vertigo? A lot of hands are going to go up. Or everybody in here knows somebody that's had it. And then because of the beautiful state in which we live and the region in which we live in that state, and I didn't learn this because I'm from Ohio. I didn't learn this until I moved here. I'm from Ohio and I practiced in Florida before I came here. But what I learned about this beautiful state here, I've been here 10 years now, so I know it now. We've all heard this analogy that we live in this bowl and these allergens are terrible, right? Well, those allergens affect those levels more than anything in this region. And so we'll see, like this time of year, you felt it this morning, right? Yesterday it was a little chillier. Today that humidity hit, and I got a joke about that. I have an old hound dog. She's not old, she's middle-aged, but I got a hound dog. She's got those floppy ears. And if I wake up and that dog's looking like this, guess how my office is going to look that day, right? So today, which is weird, but Miss Carolyn's head tilt might be a little worse this morning than it was yesterday because the fluid is thicker, if you will. Viscous. It's a fun word to say. I like that. So when we look at common neurological challenges in retirees, I'm going to take that word out. That's not, I don't like it. Anyway, reduced reaction speed. Yeah. Memory impairment. What would that have to do with your memory if your balance is off? It's pretty simple to think about. One, the brain is what's called somatotopically arranged, meaning every body part that you can sense is laid out on your brain. It's like a map, okay? And then because of that arrangement, your balance system and your hearing, makes sense, are very closely related or in terms of location in the brain itself. So when we look at the cognitive impairment or the memory impairment of it, and this is, in the younger population, I would say, a dizzy person that's 25 is extremely anxious, and vice versa. An older person who has balance issues, or let's even go a step further, they can't hear well, has memory impairment. Why? Because if the ear can't sense itself in space, you can't hear. Meaning if I tell you this lesson, you're only going to pick up a certain percentage of it because you didn't hear everything I said. So therefore, what's your memory lapse? You didn't hear me. So you didn't learn like you used to, kind of thing. What's the second part of it? If your energy is being driven towards, can I make it to the dishwasher without falling over? You don't have time to store memories. So you'll actually see a depreciation of, and it's if you don't use it, you lose it kind of thing. If your ear issue is bad enough, your brain tissue, and I love what the medical neurologists say to you guys who are older, and they take a picture of you, normal aging process, or normal aging atrophy. Atrophy is a big word, that stinks. So where does the human brain atrophy? Everybody in this room, well, I won't say that because these guys look smart back there, but everybody's brain is shrinking, including mine. And that's called atrophy. If you lose a nerve input to a muscle, it shrivels up and is atrophied. So the brain itself, and this is something that I may get flack from if a medical doctor talks or listens to this one, but it shrinks from the outside in for the most part. So what we see is little infiltrates. You'll look at your MRI report and it'll say focal lesions of focal lesions or white matter lesions unexplained or needs further investigation. But if you have no history, they just say that's a normal aging process. And then I heard a new one the other day because I did this with another older group that it's just cholesterol or it's mini strokes, or those are stretches. Because yeah, you could have cerebral infarct where the blood vessels themselves don't get to the area and then the garden, dries out, if you will. And that's pretty common. Microvascular disease is very common. But a lot of the shrinking that I'm talking about, as it occurs from outside in, and going back to that map equation, if part of the map starts to disappear because of lack of blood flow, because of lack of stimulation, or just because you're getting older, which is not the reason, the pathophysiology, it's not getting the same blood. But if it starts to shrink from the outside in, what's on the outside? Your ears, your executive function, and your balance. So as it shrink wraps in, you start to lose those abilities from the outside. So as long as doctors like me know that layout and can teach that layout to you, so this is what we do in our office. Neuroanatomy relevant to balance and cognition, I just talked about that. Frontal lobe. The cerebellum is very important, which is the back side of the brain, called the little brain. We used to think that it was mainly related to, well, not used to, we still do, coordination and posture. That's very true. But there's some papers out talking about how it's important in emotional regulation and other cognitive processes too. So it does a lot of things. I call it, it's kind of the governor or the governess. And a lot of times in our younger population, we're talking little kids. And my friend Lois would know this. Little kids who have learning disabilities or maybe ADHD or one of those camps where they can't pay attention, if you check their cerebellum function, specifically, I find it to be if it's really bad on one side, but it's not so bad on the other, or you see actually flip dominances, meaning like one eye is their dominant eye and then their other hand is their dominant hand, a little crossed-wired there. That cerebellum is the most important piece to stabilize. Because if they can't coordinate movement, it goes back to, I can't hear you, I can't learn. So the cerebellum's role in balancing cognition, the reason why we have cognition there is that cerebellum, if I can't stand straight, I can't learn a darn thing. Because my brain is very, very focused on, don't fall over, don't fall over, don't fall over. And that constant micromanagement wipes everybody out in this room in terms of fatigue, okay? It's exhausting to hold yourself upright all day. But because we don't really know that as lay people in society, we think, man, why am I so tired? And we go, let's go back to Miss Carolyn here. Well, I'm fighting gravity. And I could be wrong on this, I should have Googled it before I came. 10 pounds of pressure on my head is what the average gravitational force is. But if I go here, that's about 15 or 20. So if I put a 15-pound backpack on and try to do everything in my life, that's hard to do. So you'll hear it though biased to the actual part of the body. Meaning if I spend 20 years leaning like this, and it's pretty predictable on people, so I'm sorry if I'm talking about your life. I'm not guessing. No telepathy up here. It's just pretty predictable. If my head is tilted like this for 20 years, 15, 10, whatever time frame, we start to develop lower back pain on the back left side going down that leg. And the wrong doctor would call that sciatica. And everybody in this room knows that one, right? Because sciatica stinks. And so then, and even my camp will do it wrong. The chiropractor will come in and be like, yep, your hip's high. Let me smack it. And they'll push it and do all these manipulative things to the tissue. And unfortunately, if they don't think about that posture piece being driven by your actual brain, they're going to hammer your low back and it'll feel better for a time, but it keeps on leaking back and coming back, and then it ends in surgery. So how do we prevent low back pain with the same thing that I'm talking about? Is we actually use the eyes, the ears, and the full spinal column as a way to get her from here to here. And so where that starts is, and I'm down the road a little bit, but it's important. So the vestibular system and balance control and the frontal lobes, where does that come in? The vestibular system is that equilibrium system that I'm talking about. If you can get it within about 4 millimeters or roughly like 4 to 6 degrees of center, meaning if this is 10 and I can get it to like 6, you think better, you circulate better, your back doesn't hurt as much. Because a lot of times what happens is if your house is leaning and you put a little wedge underneath it, and I'm talking about a neurological control, like you actually have better posture because we reshaped the structures in the brain by activating it, your back pain goes way, way down. And then the likelihood of it coming back goes way, way down. So that's where my practice building issue is if you fix that thing that the chiropractor couldn't get rid of for 15 years that I saw him for every week, chiropractors start calling you going, what the heck, dude? She had a disc issue. How'd you get rid of the disc issue? We didn't get rid of the disc issue. Disc is still bad. We changed the neurology and the sensation to the disc. So the vestibular system and the balance control of this, it's a two-way street. If you fix your balance, a lot of times you think better. And so the brain loves 3 things. I'll talk about the diagnostics, how we figure it out, because that's what everyone wants to know. What do you do? How do you find out, and what do you do? The brain loves 3 things: oxygen, glucose, and stimulation. So we try to be doctors of all 3 of that. Glucose is not a Krispy Kreme donut. And sometimes it's not a kale salad either. We try to tailor the nutrition to the person, meaning we'll actually do a bunch of evals with your hair, with your blood, and with your stool, which is everyone's favorite. Please don't send me pictures. That's gross. Send it to the lab like I ask you to do. People send me pictures. So we look at the stool, we look at the blood, and we hair mineral analysis. So if we pull your hair, it'll tell us a whole bunch of things about what's in your body. And so what we do is we try to tailor the nutrition to the specific person that we're sitting in front of. I was talking with Lois to start today about how we're finding where a lot of people will flag in this Viome, this gut test, where they think, hey, I'm eating low carb, I'm eating high protein, a little higher fat, staying away from the packaged foods, but I'm still feeling really lethargic. And then you take these tests on them, you see like they're really sensitive to the skin of a pear. My joke is there's in that list too, there's like a whole bunch of animals. So like guinea pigs is the first thing, which is funny. And no one has a guinea pig. Well, people have guinea pigs, I guess, but guinea pigs never flag. I'm like, well, yeah, because no one's hanging out with guinea pigs anymore. But actually the Nashville Zoo has a big collection. But anyway, so it tests for even random things like that. My favorite part about those tests are they actually test for things that you wouldn't think about. Most people aren't thinking about their household products and stuff like that. So it will actually show us the household cleaner that you're using is a respiratory ailment for you or an irritant for you. Let's pull that back, use something different. You'll see some neurosymptoms go away. So we're trying to tailor it that way a lot. Down to, and then people go, well, you're going to tell me never to eat pears again? No. but we're gonna, change it up a little bit. Don't eat it every day, that kind of thing. So we'll intervene where it's necessary. Are you telling me I can never have chocolate cake again? No. Because I have a joke with my people in the retirement group. Hey, you better live a little bit. So if you want ice cream, well, you better have it. You never know. So I don't take everything away. A lot of doctors in alternative medicine will strip you away and say you can never touch it again. I think that's silly. Then you become extremely sensitive to it. If I tell myself that peas are bad for me, my brain's pretty smart. It'll start organizing the enzymes in my mouth, in my stomach, and in my pancreas to never eat a pea again. So what you say out of your mouth also controls your brain, which is a little hokey and way too far for this conversation. But the second piece that we usually do, so that's the glucose. The circulation piece is very important. Where most older folks lose circulation is from their neck. So we don't think about that because in the medical world, we really parcel out the body. Your head, your neck, your arm, your liver, no connection. So you have to go see the hepatic specialist, you got to go see the kidney doctor, you got to go see the cardiologist. And every person in this room goes, that's so confusing. That doesn't make sense. And no, it doesn't. No, it doesn't. So that's why chiropractic is a great kind of catch-all in terms of understanding, because chiropractors, since the inception of this discipline, have understood, hey, this thing's all connected. B.J. Palmer said one of my favorite quotes, I actually have it hanging in my office, every cell in the human body is connected to the thing under your cap. Right? So your brain and your body are connected entirely. And when we start parceling it out and going, well, I think you just have a mitral valve issue. That's not the whole story, right? Your brain, specifically the medullary centers of the on the right side, control your SA node, right? So your heart is being driven by your brain. And your heart is giving feedback to your brain. And we miss that somewhere in our education in terms of medicine and in terms of how we treat the human body. And so what I mean by that with circulation, and this is something that we've really been owning. I literally just talked to a doctor like me in Michigan. He does this transcarotid Doppler evaluation, which is essentially they put an ultrasound unit on your neck as they're doing these random eye movements. Okay? So if I'm going to stimulate the right frontal lobe, I'm going to look out to the right. All right? And if I'm going to do it quick, I'm going to look out to the left. I don't want to get confused with that. That doesn't matter. But let's just say doing this right here stimulates the heck out of my right frontal lobe. And if I have a right head tilt like my friend in the front here, that's going to be a decent therapy for her. So what does she do? She comes into my office, we put this fancy little laser on her head, and she follows this silly little target over and over and over and over again. And what happens in the second visit when she comes back, she's better at doing it. She can do it faster, she can do it faster, she can do it faster. And then on the third visit, she walks in, and instead of walking in like this like she did the first two, she walks in like this. There we go. You've been doing your homework, Miss Carolyn. And so then what she tells me after that, about third or fourth visit, she goes, I didn't even tell you guys about, this is my favorite thing that happens every day. And it sounds crazy. It's not, it's just physiology. Every day someone comes in and goes, I didn't even tell you that I've been having this irritable bowel issue. Meaning I get nervous about, my husband ticked me off or my wife ticked me off. And then I get all antsy in my gut. But ever since I've been coming here and doing these stupid little head things, I haven't had diarrhea. Interesting. That's great. I'll write it down and remind myself that I'm doing okay. But so it's a catch-all sometimes, not all the time. Those are miracle stories, but it happens. So the circulation piece that I'm talking about, the doctor will do that head move. In Michigan, I don't have the fancy device to do it. I listen to it with a stethoscope. So we walk in here and she's like this. We can all kind of picture. There are pipes going up called the carotid arteries. I'll just use the carotids, there's more, but we can all understand the carotid artery, meaning if everyone touched their pulse, they can feel it right there. So it's all governed by pressure, meaning if my head's tilted like this, it's really pressurized down here. So blood does not get up that tube efficiently. The other tube, it's pretty good. That's why we don't die. It's a closed net, it's a loop, right? So if blood doesn't get up this way very well, guess what? Your brain's pretty smart. It shoots it up this way a little faster. And then you go to the wrong person, they put a blood pressure cuff just on one side. So we bilateral. We're looking at both sides, see differences in everybody. We do it at the same time. So we do it at the same time, see differences in everybody. Why? Because her head's been tilted like this for 10, 15 years. It's even worse because she's tilting her left ear to me, meaning her left ear hears better than her right. So that right ear is totally neglecting the world at this point. So all that blood flow that can't get there, it's shutting stuff off. Your brain loves three things: glucose, circulation, and stimulation. We are doctors of stimulation, but then we see and glucose really, and then we see changes in the circulation. So I'll put that stethoscope up to somebody's neck, have them do an eye movement off to the right repetitively, watch their head tilt change, then put that stethoscope up there again, boom, boom, boom. Put the blood pressure cuff on them, even, even. Put the pulse oximetry on them, even, even. And when they walked in the room, or into the treatment room, high on the blood pressure, high on the pulse oximetry, low, low. And then you do these stimulations to the right frontal lobe, balance, 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 balance. And that's actually my first goal with older folks. Because the orthostatic issue that you've heard about, right? Meaning I stand up from seated and the world spins a little bit, that's the problem. So if we can make your body more efficient at delivering blood to your brain by exercising it in a very low force, but easy, or an easy way, then we're going to change the way that your brain recruits blood. And in the younger population, unfortunately, after 2020, it got a little different because infectious things actually can infiltrate this a little bit, so you do have to know about that. I'm not going to talk about that, but essentially meaning if you've gotten sick, those arterial systems will change a lot. If you've had sinus issues chronically, those arterial systems will change a lot. So it's not just, hey, your neck went bad, you know what I mean? But generally, in all of us, because gravity's been beating us up, necks go bad. And why that infects the blood flow or the circulation piece of this is a kinked hose, and then degeneration actually recruits too much blood into the spine and you actually lose more to the brain. So the second or third most common cause of dementia and Alzheimer's disease, it's called microvascular or vascular dementia. Everyone in this room's probably heard somebody talk about that. What does vascular dementia mean? Not enough blood going up. Then areas of the brain begin to die. And the analogy I use, which is in this population is probably okay, it's a garden. It needs water. In this case, it needs blood, which is oxygen. But if that hose is kinked in too many ways, you start to lose water to fractions of the garden, you'll lose your plants. Okay? So our job is to figure out where is it missing water and try to deliver it via stimulating the brain, via simple eye movements. We increase in complexity, so let's go to the diagnostics. The diagnostic and assessment tools that we use in the office, I just told you 2 of them, which is we check the carotids, we check the cervical range of motion to see, is it broken here, is it broken there? We check the kinks in the hose, we check the gut lining, we check the liver enzymes, so all the blood work that your doctor would give you, I say bring it in, let's read it. And so we look at, well, it looks like blood and nerve input is a little down to the pancreas, let's do something for that. A lot of times that is herbs. People go, well, what do you give me? I don't load people on supplements. We start with the food. Then we the most common supplement in y'all's age range is the B vitamin. And a lot of times omega-3s, because unfortunately, a lot of the food that y'all will ingest, or the way that you were taught to cook here in this lovely state, the oils are probably a little bad. So we try to do it with nutrition before we do it with any other pills. And I just don't think that it's healthy to load older folks onto a bunch of supplements that they spend a lot of money on. And the effect of them is usually pretty watered down, no matter what that bottle's selling you. And I got Miss Susie who'll come in there. That's not her real name. I'm thinking of one lady in particular. She popped in there. She'll come in with her bag. She's like, I found this at the grocery store. It's going to take my neuropathy away. And I'm like, probably in 100 years, but you'll be gone. So you'd have to take so much, it won't get, it would take, it's endless, you know. So we look at the nutrition hard, and then the balance and reaction time evaluation and the VNG, which is probably one of the most important. The VNG, video oculography for vestibular assessment. VNG stands for video nystagography. That is a device that we put you in front of, and it quantifies those eye movements. So it locks onto your pupils and it follows you around. You basically watch a series of dots. And then some people may have taken that in here at like Vanderbilt Balance or something. And then we couple that with doing it in multiple positions. Meaning, is it bad if your head's turned to the right? Is it bad if your head's turned to the left? Seated, standing, etc. And we figure out where the breaks are depending on where your position is. So we'll see breakdowns in eye movements. Okay, let's just use the example. If my head's tilted like this, a lot of times the pursuit to the right is bad. And why is that? Because, and this makes so much sense to people every time I say it, if my head's chronically tilted like this, I can't look up to my left very well without straining myself. I can look down to my right because I kind of live there, but it's very shaky when I'm at end range. So your eyes, your ears, and the muscles of your spine are very, very balanced. So much so that if I'm looking at you guys and I'm moving around, I'm going to lock onto that big white cup there, and I'm going to keep my eyes locked on it. But as I move, my eyes and my head are opposing each other at the same speed, same rate. So what we would see, and this is where visual acuity comes into it, if I'm looking at that cup and it says racetrack on it, but I'll lose that R the faster I go. If you perform bad on the V and G, you can't even see the R to begin with because your eyes are dancing even when you're sitting still. And so our job is, can we stabilize that eye movement in the still position? Then can we stabilize it when you're walking? Then can we stabilize it when you're laying down? However, whatever combination you want to do. So where I always start is, can I stabilize this lady's eye movement or this guy's eye movement? And if you can't, people go, well, what about if I have this weird brain and underlying thing and you're not looking inside? I'm not proud to say it. I'm actually depressed to say it. Found a bunch of brain tumors by taking that test. And you go, man, that right eye is really bad. That's abnormal, Bill. Go to Vanderbilt. 5 times actually in the last 4 years. So why do we find brain tumors is because when it's abnormal, we know it. We've been trained for red flags. And also you'll see those changes in blood pressure. I found a UTI yesterday. The lady went to the doctor. The doctor said, there's no UTI. I was like, okay, my bad. I'm sorry I sent you to the Mediclinic. 2 hours later, her medical doctor, her primary care called, hey, I got this urine analysis. It's small, but there's bacteria there. I'm gonna send in an antibiotic. How did I find the UTI? Blood pressure was through the roof on that one side. So then I checked it in her leg. Then I took out my little surface thermometer, 97.6, 97.6, 97.6, 101 on the kidney. I think she's sick. And she is. Actually, I'll tell you the funny story. Glad that it's on TV. I hope she sees it. I said, ma'am, do you know my name? I've seen this lady every week for a long time. Ma'am, do you know my name? She knows my name. She knows my kid's name. She knows my wife's name. She's very with it. She's 92 years old. Her cognition is very clean. I said, do you know my name? She goes, no. Why was she confused? She couldn't filter all the toxins out. That's why UTIs make women confused, or men. Older folks who get chronic UTIs, you've heard those stories too. They get a little bit confused. She was not oriented. She didn't even know my name. The funny part is, the comment that she made after was, do you have, I said, do you know my name? Do you know the year? Do you know the president? Do you know where you are? That's kind of the mini mental status. And when I said, do you know my name at the back end of it, after I had told her, she goes, do you have hair on your chest? A little bit. I laughed. And she goes, did I embarrass you? I go, not at all. But I'm going to send you to the doctor. Luckily, her daughter was in the waiting room, so she got there safely, guys. Her daughter drove her. And then it was funny because the daughter texted me later in the day and said, they didn't say there was a UTI. And about 4 hours later, I got another text that the doctor her actual doctor, was sending in the antibiotic because there's a small UTI. So we're good at looking at those things through the weeds a little bit, just because we're good at knowing the body. And if that lady, it was obvious she was off. She was saying weird things, right? So you're like, we better get you looked at. But first thing I did was scan her eyes, just say, hey, look at this. Nothing was broken. So I'm like, well, she didn't just randomly develop a brain tumor. And then started poking around at those kidneys. And that's how we found that. But so the balance and reaction time evaluation, we do that at the bedside. These types of things, right? And then we do a full cognitive, I use this thing called C3 Logics. Essentially, it asks you a series of questions that kind of quantifies your bandwidth in terms of cognition. So a lot of doctors in my camp use fancy gadgets. I like to be simple. I could do an evaluation on everybody in here with just my finger in terms of, hey, follow my thumb, and give you some good advice. So I like to be simple. I do own a V&G. I do own a pretty fancy cold laser that we use for treatment. And then we do have that reaction time test. It's just nice for patients to see where they're bad and then make improvements and show them how they've improved. But a lot of times, subjectively, people know that they're improving. They're like, man, I'm just sharper, my daughter. What I like is when the kid comes in with an older folk, or their husband, or their spouse, rather, and they're like an example yesterday, a lady named Mary, I love her to death. She's been having paranoia. She's definitely slipping into that cognitive impairment, Alzheimer's disease type category. And so what we're trying to do is just stabilize her to where she feels safe in her environment. If her partner leaves, she does get paranoid about it and then has an emotional outbreak about it, crying, screaming, etc. It's kind of that sundowners phenomenon. And so we've really been working on her parietal lobes, which is where you can sense yourself in space. And for about 3 weeks, she hasn't actually flipped out when her significant other goes out. So that's been positive. So we're looking at real life things like that. And the other difference is you're probably evaluating is I'm a real life human being who's been through a bunch of different things in their life. So I don't get on this doctor pedestal and be like, are you not taking your beetroot, Mrs. Jones? I'm like, hey, I get it, So I like to be very personable in my approach. That's why my office manager is happy that my first patient canceled today, because he's going, he better be up here. I know he's talking to those people. We're not even getting paid for it, or whatever. But I love this. I would sit here all day with y'all and talk about this, because I bet I can go around the room and everybody be like, hey, I got this, I got this, I got this. And I would entertain all of it. My wife hates it because I can't even go to a family gathering anymore. Grandma's got her list. I'm like, dang. And my wife's like, people just keep calling about these random problems. I'm like, yeah, well, I care. Okay. So treatment strategies, I talked about it. Cerebellar rehabilitation exercises. These exercises include weight shifting and single leg stance activities aimed at improving coordination and posture by targeting cerebellar function. A lot of times people want takeaways. I like to be very specific. And what I mean by that, you'll see blanketed across the internet or in other disciplines where they're like, well, your left side balance or your left cerebellum is weak. So therefore, you need to do these crazy things with your left arm and stand on your left leg while you brush your teeth and stuff. And if I asked everyone in this room to just stand on their left leg for 10 seconds, it's going to look like this, or it's going to look like this. Heck, for some of y'all, I can't even get that foot up, man. And so is that a way to train it? Probably not. It's too weak to do it. If I sent you all to the gym and was like, hey, we're going to put 200 pounds on the bar, can you do it? No. So I don't like single leg stance stuff when I'm given the practice or the exercises. I like to start simple. Usually I will lay the patient in the lying on their back position, and we'll check the eye movement there. We'll check the circulation there, because what's not affecting you when you're laying, it is affecting you, but it's not affecting you in the same way as when you're standing or seated. Gravity. So if we take gravity out of it for a second, we stabilize this is where people get really hung up too, especially older folks, because they're not listening to the first lecture I just gave. And it's just so, When I'm speaking about it now, I feel like everyone's kind of like, yeah, that makes sense. Your eyes, your ears, your neck, yeah, that kind of makes sense. And that happens every time. But then when you talk about the simplicity of it, it just can't be true, right? But if everyone in here went to Pilates or the gym and they got stronger, how would that happen? Through a series of repetition and doing something. And so these are proactive approaches to these brain problems, not just sit and depreciate, right? I'm trying to make that right eye work better. So the first celebration that I have with Miss Carolyn is she comes in, and when I say, hey, Carolyn, how you doing? She goes, good. And I'm like, or even better, we get that V&G up in front of her, and she's got this squirrely thing going out to the right, and then 2 visits in, she comes in, and it's like, or hell, it's even, hey, that's better. That's what's up. And so, when I talk about what to do in terms of how do you stabilize your balance, a generic thing that I'll tell folks if they're not coming in to see me to get specifics, don't stand on one leg and expect your balance to get better. That's silly. What I would do is I would work on my cervical range of motion first. So I'd sit in a chair every morning when I wake up, and I would hit the extremes. I'd look up with my eyes. I'd look down with my eyes. I'd look to the left. I look to the right. I look up and to the left. I look up and to the right. Follow my thumb in and out. Kind of exercise the eye muscles a little bit. Focus on something. And then stretch your neck, right? And I'm not talking 20, 30 seconds. No one's going to do it. I'm talking just a little lubrication, right? Simple little directions. So you go up, you go down. You go up, you go down. That will get some of that circulation going. And then you do it in your shoulders. And then you do it in your arms. Then you do it in your legs. And then, yep, you do it in the back. And then you get up and you start your day. Now, could we be way more specific about that? Yeah. But just doing that, because here's what happens in this world here. I'm sorry if I'm locking you into group here. You wake up, you roll over. Hopefully no one needs an alarm in here anymore, but if you're still working, I'm sorry that you do. I don't need an alarm. I have 3 small children, 1, 3, and 5. So at 4:55 this morning, my son told me, hey, you got a lecture. That's what he said, actually. It's crazy. No, he didn't. He's 1. He cried. So you get up. Hopefully you don't need an alarm clock. You kind of sit up on the edge of your bed and you go, whew, I'm a little off balance. I'm going to let this settle. And then you get up, you walk over to the side of your bed where the walker cane side table is, and you kind of go, and then you mosey to the bathroom. Foot hurts, knee on the left, back right shoulder. You're like, oh man, it feels like a darn weighted vest. And then by the time you get up off the toilet, you're a little smoother. And so then what you do is you go to the coffee pot. And the next 45 minutes is spent right there. Kitchen table. Hopefully it's not in front of the news. A lot of times it is. So my offering to most individuals of your age group is when you roll up off the side of that bed, please don't pee yourself. That would be terrible. Do what I just said. Strengthen it, lengthen it, move your eyes up and down. Look at something. My advice for most people, unless you get up every day before the sun rises, look out the window. Don't look at your phone. I got 3 bird feeders in the back. I wake up, pull the shade up, kids crying. I'm like, you just wait. So I do this little stretch thing myself at 34 years old. I just do it, and we all know this, dogs and cats do it every morning. Why don't we, right? They kind of get up out of their bed and do this little shake off. So I get up. I'm a little crazier. I'll bounce around and stuff. Don't do that. But for you, just sit on the edge of the bed. Hopefully you got some light, natural light coming through the window. Don't look at your phone. Don't worry about the digital clock there on the. Doesn't matter what time it is. Hopefully it doesn't if you're retired, retiree. Look out that window. Take a few deep breaths. Before you jump to the coffee, have a glass of water. Put a little pinch of salt in it. Get some minerals back in you. Rehydrate. All right? A little pinch of salt go a long way. And everybody in here goes, well, my cardiologist told me not to have any salt. I know. I'm not saying salt the elder thing. I'm talking a little pinch because that actually helps you absorb water better. So about for this age range, 8 ounces of water before you have the coffee. the coffee that you enjoy so much, whether you put cream or sugar or whatever it is, if you wait, studies say, if this population waits even a half hour, your metabolism works better, meaning you'll have a bowel movement sooner. The effect that you think you're getting from the coffee, it kind of wakes me up, it will be more effective. For my age range, they say wait 90 minutes. And so if you wait a little bit and you hydrate first, that little nausea you get before breakfast, it won't be there. Because that's dehydration and that's low blood sugar. And then the next thing that I would suggest doing is don't turn that news on. Call a friend. Talk to your husband, wife, whatever. Pet your dog. Don't start your day shot from a gun. And if you're not working anymore, it doesn't make sense. I wonder what I'll do when I'm not working. Because I wake up and the first thing I think about is like, all right, I got to be down there. Get that diaper changed, run the vacuum. Make sure the kids are ready for school. My kids are homeschooled, so it's a little easier, but my wife does all of it. She's a champion of that. So don't start your day shot from a gun, meaning in a hurry. Slow down. Take some time to mobilize your body, hydrate it, then get that coffee. Hour in, maybe turn the news on if you want to know about the weather and stuff. But as you all know, everyone knows this, I tell you, nothing but bad news on there. These darn potholes on 24, right? So no one wants to hear any of that. And what that does for y'all's age population, blood pressure up. And everyone in this room can't afford to have blood pressure up. Cortisol, through the roof, even though it's not supposed to be at your age. So starting a lot slower and ending it slow too. So you do the same thing. You stretch before you go to sleep. Go figure. So you do that same little routine. You sit on your bed and you stretch. Most people won't do it because they don't want to pee in the night. 3 ounces of water with a little pinch of salt. Sit down, stretch out. Take a few deep breaths. Turn the light off before you lay down. Sit in that dark and let it all kind of hit you. Let that melatonin and all those calming systems set in. And then lay down and go to bed. Not with the TV on, not with your book light, in the dark. And you'll find that those 3 a.m. wake-up calls that you get, and you go pee, and then you wake up and you go, I wonder how Billy's doing in Arkansas. And you can't go back to bed, it'll go away. Or at least it'll push to like 5, and then most people in this room, 5, 6, you can probably do it. But those little insomnia attacks, you're dehydrated and you're hungry, or your cortisol levels never calmed down because before you went to sleep, something was happening overseas and you watched it. So if you can shut that stuff off about an hour before, really start calming it down. I like to read under some warm light personally, although my wife and I season 50 of Survivor until last night before I fell asleep, so I broke my rule. I really haven't watched Survivor, but last night I did, and it was entertaining. So yeah, and I like sports too, you know, so I'll stay up late and watch some sports. I'm bad about this too, but I usually always stretch when I lay down on that bed, and I always stretch when I wake up. And the first thing I do is look out that window at those silly birds. I had a lot of blue jays out there this morning, even in this rain, which is nice. So not starting shot from a gun can help a lot of these problems too. And then doing those stretches are important because then you integrate the balance stuff, the eye, the neck, and the spine. And those are just simple little take-home things. So when I talk about but however, if you come into our office and you go, well, what's my homework for you to make this problem better? I don't send you home with a pamphlet that has 8 things on it that you couldn't pronounce and you don't know how to do, and every time you do it, it hurts your low back. That doesn't make sense, because then guess what? Compliance goes way down. I start very simple, which is how do we stabilize the eye movement first? So, Miss Carolyn here, I'm going to need you to turn your head to your left, turn your head to your right, or whichever direction I choose. And we're also going to couple that with an eye movement, and you're going to do that 5 times a day, just 3 times each. And so the exercises begin just 30 seconds of your time, a couple of times each day. But what I find that also does is it brings the person back to the points that I'm making right now. Oh yeah, it is my right frontal lobe, my left cerebellum. So if I bring those 2 things together, and the second you start thinking about, guess what gets healthier? Your right frontal lobe and your left cerebellum. So that's why these education things are important. So the outcomes and benefits of functional neurology intervention, you guessed it, improved balance and reduced risk fall, enhanced reaction times, and better cognitive clarity. So optimizing neural communication and movement's role in brain longevity, I just talked about that, right? So regular physical and cognitive activity sustain brain plasticity, and then functional neurology enhances brain-body connections by leveraging neuroplasticity to improve balance, memory, and movement coordination. When I'm talking out in the public, I like to say chiropractic neurology, because chiropractic gets a bad name in society. Not just from countering doctors. I couldn't tell you how many times I go to a friend's house and their dad's sitting there, probably drinking Pepsi, and he's like, man, I went to a chiropractor once. Dude hurt me. He didn't know a thing. I'm like, well, he knew a lot. But he's right. Chiropractors, unfortunately, forget why we do it. And why we perform chiropractic adjustments is to actually enhance the nervous system. But if I'm just doing it to see as many spines as I can and just crack them willy-nilly and let them pay me that $50 copay or whatever it is, then we've lost sight of why we're doing it. And that's a money grab there. Why we're doing this, or why I'm doing it, as I talked with a neurologist this morning, I love human beings, and human beings deserve better than what they got. And we're getting misled a lot in medicine, in health, and that's not the doctor's fault. That's not it's not the man getting us. We're out of time. We're out of resources, and those doctors are burnt out. So they go to their easy options, and then they're governed by this thing called standard of care, which we are too. And what I know about every standard of care, every physician that I ever met, and myself included, my wife as well, we took this thing called an oath, right? To never do any harm and treat everybody like they're supposed to be treated and all that stuff. But I bet everyone in this room has been to a doctor's office and they were mistreated. And a lot of times it's not because the doctor feels he's the smarter one in the room. He's tired. He didn't get up and look at the birds out his window. He got up and was stressed out because he's got to see 100 of you people that day, and he's tired of it. And so that's where it's failing us, is you don't have, and why doctors like, good doctors here, so we're lucky we live around Nashville, Tennessee, because there's a lot of alternative doctors out there who take time, who listen to you, who are empathetic. That's important. So how do patients get better under doctor's care? The doctor listens and gives solid advice, not take this and see you next month or 6 months, which is worse. So my overall goal in life is, and I'm going to keep talking to as many groups like this until it's done, and I'm trying to connect as many doctors as I can to do it too. Education. Y'all don't, like if we walked around this building here with all the other individuals that haven't heard this lecture, you go, hey, point to your kidney or point to your spleen. People be like, I got one of them? Where's it at? And they do that like New York City or something. They walk up to a random person and be like, hey, where's your liver? And they're like, don't know. I have a liver. Even my own office manager sometimes. But yeah, so education and understanding your situation and your body goes a very, very long way. And if we don't have time to explain it, well, you don't need to know about it. You just got this thing growing in your pancreas. Forget it. What? I can't forget it now. So the overall goal of my practice, and I've only hired people that feel the same way, is we care about the people that walk in there, probably too much, even to my own detriment. We give them quality care, and we try to make it as affordable as we possibly can, because we're not in it for that. And there's a great saying out there, if you help individuals solve their problems, you'll never have one. And so I've been blessed beyond means because of this discipline. And I know it seems I may be passionate about it. What I didn't lead with is when I was a little kid, my mom had a stroke. And so what drove me to really be passionate about is I saw all this dysfunction, and my upbringing was a little bit, not different or not bad, but she struggled because of it. And so when you see somebody who's went through it for 20 years get better, then I want to do it to everybody, right? And especially someone like my mother who I care about deeply. And so taking that same passion into every single patient, and I thank goodness that I still have it after 10 years, but I care about this way too much, and I think it's helping people.